So we start with the anatomy of pharynx. Pharynx is the junction between respiratory tract and alimentary tract. Alimentary tract means digestive tract. So this is the junction or the in between part of the respiratory portion and respiratory tract and the alimentary or digestive tract. Circumscription or the boundary of pharynx. So pharynx extends from superior portion at the superior portion or at the upper portion. It extends from the base of the skull to the inferior border of cervical sixth vertebra, and at the anterior part or at the front part it is connected to the nose, mouth and larynx, and at the posterior part this is connected with prevertebral fascia. So here like this, pharynx lies from the and it extends from the superior from the base of skull to the cervical sixth vertebra, and at the anterior this starts from the nose, and at the posterior portion it lies to the it extends to the prevertebral fascia. Okay. Next is subsection of pharynx. That means parts of pharynx: nasopharynx, oropharynx and laryngopharynx. Okay. Nasopharynx lies from the skull of the base to the free edge of soft palate. From the skull of the base to the free base of soft palate. This is the soft palate. This is the hard palate. This is the soft palate. This one is the soft palate. This one is the hard palate. So from here to here it is called the nasopharynx. Oropharynx. Oropharynx lies from the free edge of soft palate, that means where the nasopharynx ended, to the superior border of epiglottis. So from here where the nasopharynx ended, from here to the epiglottis, to the epiglottis border. Okay, so this one is known as the oropharynx. See, this is the oral area or area near the mouth, and next one is the laryngopharynx. This is also called as hypopharynx. So from superior border of epiglottis to inferior border of the cricoid cartilage. From superior border of epiglottis, this one is epiglottis, this blue portion, to the inferior border of cricoid cartilage. Okay, so this portion is known as the laryngopharynx. So this is nasopharynx. This is because this is the nasal area. This is the oropharynx because this is the oral area, and this is the laryngopharynx because this is the laryngeal area. Okay. Nasopharynx in this view, this is the posterior view of different parts of pharynx. This is the nasopharynx. This portion is the oropharynx and this portion is the laryngopharynx. Nasopharynx, this is adenoid pharyngeal opening of the auditory tube. This is auditory tube, torus tubal and pharyngeal recess. So in nasopharynx is basically the adenoid portion. That means this is filled with, or this is composed of numerous number of glands. Okay, adenoid means related with glands. Okay, next one is oropharynx. Oropharynx is also called mesopharynx. Okay, so here the glossopalatine arch. Glosso means related with the tongue, and palatine means related with the palate. Soft palate and hard palate. Here it is soft palate. Okay. So glossopalatine arch, pharyngopalatine arch, tonsillar palatina, lateral pharyngeal bands, pharyngeal posterior wall, etc. These are the structures present in the oropharyngeal area. Next one is the most inferior part is known as laryngopharynx, or this is also known as hypopharynx. Hypo means inferior. Okay, hypo means inferior in position. So laryngopharynx is the most inferior or lowermost part. This is also known as hypopharynx. Here the atrium of larynx, vallecula epiglottica, pyriform sinus and post-cricoid space can be found. So these are the structures which are related to different parts of the pharynx. That means nasopharynx, oropharynx or mesopharynx, and laryngopharynx or hypopharynx. Okay, so this is the nasopharyngeal portion which is viewed from an endoscopic picture. This is the oropharynx or mesopharynx. This can be viewed by bare eyes only, by normal inspection only. And this portion is laryngopharynx. This cannot be seen from the outside. You will have to apply a tool or some optic instrument to view this. Okay, so this one is the laryngopharynx or hypopharynx. Structures of the pharynx or pharyngeal wall. This pharyngeal wall are composed of different layers. What are these layers? There are mucus layer, fibrous layer, muscular layer and mantle layer. Mucus layer, fibrous layer, muscular layer and mantle layer. Okay, so 4 different layers are there. Next is pharyngeal lymph tissue is composed of pharyngeal lymphatic ring, or this is also known as Waldeyer's ring. So pharyngeal submucosal lymph tissues or inner pharyngeal ring, these are composed of adenoid tonsil, tubal tonsil, tonsilla palatina, lateral pharyngeal bands, folliculus lymphaticus of pharyngeal posterior wall, lingula tonsil, and all these portion they drain into a group of lymph node which are also known as the outer ring of the outer pharyngeal ring. And these group of lymph nodes include retropharyngeal lymph nodes of the mandibular angle, submandibular lymph nodes and submental lymph nodes. So inner pharyngeal ring or inner pharyngeal submucosal lymph tissues, they drain into the outer pharyngeal ring or outer pharyngeal lymph nodes of the neck. These are the group of lymph nodes which includes retropharyngeal lymph nodes of mandibular angle, submandibular lymph nodes and submental lymph nodes. Next we will see acute tonsillitis. As the name suggests, this is the acute inflammation of the tonsil. Classification: acute catarrhal or superficial tonsillitis and acute follicular tonsillitis or tonsillar crypts are filled with purulent material or pus is there. Okay, pus filled or suppurative material. It affects the school going children mainly, but obviously adults can also be affected. It is rare in the infants, like less than 1 year. In the infants aged less than 1 year, this is rare, and this is also rare in people over 50 years. And the causative organisms include group A, beta hemolytic streptococcus, Haemophilus influenzae, Streptococcus pneumoniae, adenovirus and Epstein-Barr virus. So the causative organisms include a wide range of organisms where there is bacteria and there are 2 different viruses. Okay, 2 different viruses. Number 1 is adenovirus. Number 2 is Epstein-Barr virus. This Epstein-Barr virus is also associated with the causation of nasopharyngeal carcinoma. We should remember it and we will see it in later in our class. Okay. Signs and symptoms. The signs and symptoms of tonsillitis include sore throat, pain and difficulty in swallowing, fever with rigors and chills. In tonsillitis, there are high fever and the patient shivers. Okay, patient shivers. So this is known as chills and rigors. There might be earache, that means pain in the inward side of ear. Pain in the side of the inward tonsil. That means if the right part of the tonsil is involved, then the pain will be there in the right ear. Okay, this way. Headache might be there. Generalized fatigue or weakness might be there. Foul smelling breath or halitosis will be there. Coated tongue. Obviously, the tongue will be coated as white patches, coated with white patches. Hyperemia of the pillars, soft palate and uvula. Uvula is the small finger-like projection in the oral cavity, and this lies near the soft palate. Okay, near the soft palate. Okay, this one red. There would be red and swollen tonsils, yellowish spot in the crypts or partial tonsils might be there. Yellowish spot indicates what? It indicates the presence of pus or suppurative infection or inflammation. Okay, so whenever there is yellow spot, we will have to suspect presence of pus. Enlarged and congested tonsils with swollen uvula. This is seen in acute catarrhal tonsillitis. Catarrhal means superficial. Enlarged and tender jugulo digastric lymph nodes. So at the site of the infection, the lymph nodes would be swollen. Why? Because whenever there is infection or inflammation, there is leukocytosis, or the number of WBC would be rising. So the excess number of WBC would lead to engorged or swollen lymph nodes. See, these are the pictures of different types of acute tonsillitis. Okay, like this would be swollen, reddened. Okay, the tongue is white. It's not red anymore. The tongue has been coated with white patches. Okay. And here this one is known as the acute parenchymatous tonsillitis. Okay, here the whole parenchyma, or the ground tissue of the tonsil, is reddened or is undergoing heavy inflammation. That is why this has turned blood red. Okay, here this is also acute tonsillitis. See, this tongue is also coated with white patches, and here there is spots. There is whitish or yellowish patch. This means the presence of pus is there. Next is treatment. Number 1 is bed rest. Number 2 is plenty of fluids to take. Though what happens is that in tonsillitis there is difficulty in swallowing. Okay, so the patient avoids drinking water, which leads to dehydration. So it is very important to maintain the fluid and ionic equilibrium of the body. That is why the patient is advised to drink plenty of fluid and plenty of preferably isotonic fluids like saltine water, etc. Okay, ORS, etc. Next is analgesic. Analgesic means painkillers. Okay, the pain, there will be severe pain, soreness in the throat, and so for relieving from that, the patient needs to be served with analgesic and antimicrobial drugs. That means antibiotics would be administered. Complications. So what are the complications of acute tonsillitis? These are chronic tonsillitis with recurrent acute attack, peritonsillar abscesses, parapharyngeal abscesses, cervical abscess, acute otitis media, rheumatic fever, acute glomerulonephritis, subacute bacterial endocarditis. So these are the sequel or the complications of acute tonsillitis. Why it has different effects on different organs? Because of the causative organism. depending upon the causative organism, if it when this infection becomes severe, these can also affect the respective organs and can cause like peritonsillar abscesses, parapharyngeal abscess, cervical abscess, acute otitis media, rheumatic fever, acute glomerulonephritis, subacute bacterial endocarditis. Okay, so ranging from cervical abscess to acute bacterial endocarditis, in which the heart itself is involved. So these can be having different types of complication depending upon the causative organism. Okay, and acute tonsillitis, if left untreated or if poorly managed, can obviously lead to chronic tonsillitis. Okay, so we will see the chronic tonsillitis later.